already done most of these images on this PowerPoint. Now we're going to look at hyaline cartilage, elastic cartilage, fibrous cartilage, and bone as connective tissues. We'll save blood for a later date. So hyaline cartilage, and this is the hyaline cartilage in your respiratory tract. Okay, and I already mentioned the word perichondrium. So perichondrium are these cells in this layer right here, all the way around. And this is a cross-section of the cartilaginous ring. So if you put your finger right above your manubrium, and you can press on your trachea, it's nice and hard. And it's hard because of hyaline cartilage, keeping the airways open or patent. Okay? So this is the area, the perichondrium, where you can get cells, and here they are, that have the potential for division. Once these cells get locked up in the lacunae, they're done. So this hyaline cartilage can repair itself because of the perichondrium. But the hyaline cartilage in your joints, the articular cartilage, doesn't have a very good perichondrium, not at all. It gets worn away through bending your joints. Okay, and it's that cartilage. Without the perichondrium, you can wear out. And it's these perichondrial cells that can be used to put in a tissue culture, and you can make new cartilage and transplant it back. I don't know if they're doing that in the human yet, but they should be, because they have the technology to do that. So this is elastic cartilage, and this is elastic cartilage. Okay? This elastic cartilage is in your ears, and you have elastic fibers. These dark staining fibers that are going through this are elastic fibers because you can stretch this. It has a give. And this elastic cartilage, or a form of it, is in your epiglottis. And this is a cross-section of somebody's epiglottis. So the elastic cartilage is this stuff right here. Here's some adipose. This right here, this red stuff is dense, irregular connective tissue. Here's some more of it out here. And this right here is non-keratinized stratified squamous epithelia. Okay? And we have chondrocytes in the lacunae. Okay, this is fibrous cartilage. Again, chondrocytes in lacunae. And the fibers are organized collagen. So I had a short mind blank again. Did you notice that? Okay, yeah, and I got it, even without your help. Okay. So, this is pretty tough stuff, and this is going to be your intervertebral discs and your pubic symphysis. Here's bone, okay? This stuff is compact bone. We're not looking at spongy bone yet. We'll look at that when we get to the bone sections. And we have each one of these circumferential lamellae going around and around and around and around, forming the Haversian system, right? And in the center of the Haversian system is a central canal, okay? Probably should be using red. The central canal contains an artery, a vein, a nerve, and a lymphatic vessel. Okay, A&P textbooks are always leaving out the lymphatics. They just say artery, vein, and a nerve. No, there's a lymphatic vessel in there too, for lymphatic drainage. Okay? So, these arteries, veins, and nerves, there's some branching coming off, because if you look at it under higher power, you can see these dark lines that kind of look like spider webs. Those are called canaliculi that contain capillaries and cytoplasmic communications between osteocyte, sending out these canaliculi from one osteocyte to another in the lacunae. Okay, so this is your capillary bed in a way in bone. Okay, pretty cool looking stuff, compact bone. Okay, so here is some hyaline cartilage. And this is what we call endochondral ossification that we'll talk about later this semester. I'm not going to hold you responsible for it now. So here's your hyaline cartilage out here, and your hyaline cartilage starts undergoing changes in its morphology, okay, in those areas. And I'll hold you responsible later for the names of those changes later and what's happening to the hyaline cartilage in the process of making bone. Remember I said, you make your tissue during embryo development by making other tissue that replaces other tissue that replaces other tissue. So all connective tissue was mesenchyme first. And then in this case, the mesenchyme became hyaline cartilage. And then in this process, endochondral ossification, the hyaline cartilage is being converted into bone. So it took 3 tissues, counting bone, to get to bone. And we'll talk about this later. There's another form of ossification called intermembranous ossification. Intermembranous ossification occurs in your flat bones, like your skull and your pelvis. Endochondral ossification takes place in your long bones. Okay? So cartilage is being replaced by bone in this process. And here's the bone out here. And there's some bone in here too. But this is all bone. Okay, so this is somebody's digit, okay, and it's developing bone. So these are 2 bones in 1 finger, okay. So all this out here, this is all bone in here. Okay, this is bone in here and in here. And if you look really hard, you can see some little dots. Those are the central canals of the Harbergian system. Okay, not high enough magnification. But you can see the dots a little bit better over there. Okay, so then this is hyaline cartilage right here. Then it changes again, and then it changes again. There's 4 layers of these changes in the development of bone that the hyaline cartilage has to undergo. Okay, so this is somebody's finger during embryo development. And you have 2 bones in a finger. And that's it. Let's go to lab, dissect a fetal pig, and send you on your